One of the most common questions I get asked from patients regarding our type of treatment model is, what is intensive care and what does intensive care do? Intensive care doesn't mean intensely painful. It just means that we do a short duration, high dose treatment as opposed to long duration, low dose treatment. So we condense the care into a consecutive program where a patient will go through 2 sessions per day. Each session is roughly about 2.5 to 3 hours long, and the consecutive days can be 5, 10, or 15 days, but depending upon the size of the curve and the severity of the scoliosis. Now, this doesn't mean where patients are going through like extreme types of care and the people who are in pain or discomfort. The care is relatively gentle. I mean, all we're using is traction, we're using vibration therapy, rehabilitation, exercises, all conservative types of programs to help reduce the spinal rigidity and improve spinal flexibility so patients can respond better to their bracing and their home therapy. Patients are always under complete control, meaning is that all the tractions and all the therapies are done to the patient's tolerance. And we're always taking into account whatever we find on their x-rays, of course, the age of the patient, the size of curve, and what we're dealing with, and we customize the program. Now, can we show every single option in what I like to call this virtual visit that we're about to show you? It's impossible. We're going to show you the 3 most common: a typical lumbar curve, a typical thoracic curve, and a typical S curve. However, understand that scoliosis is like a thumbprint. No 2 patients are ever the same. And just because somebody presents with this type of curve pattern doesn't mean they're going to get this exact same treatment model. Everything is customized for that patient. The idea is a patient starts off with intensive care. We reduce the curve quickly in this intensive program, and we set them up for successful bracing, successful home care. Every component is important. One component without the other isn't nearly as effective, and what delivers the results here at Scoliosis Reduction Center is the fact that we use a multimodal approach, and this multimodal approach allows us to get results, and really superior results, I believe, to almost any program out there because of the way we combine all these things. And the combination of all these things are also coordinated in a very specific manner, meaning for somebody to get all the different therapies and rehabilitations that we do here, most people will have to consult with 7, 6 different doctors and therapists, and everybody's doing their own thing. Since we're coordinating everything under one umbrella, we make sure every piece adds to the other, so we actually amplify it even more by then having that coordinated effort. So come through our office with us and see how we go through this intensive program, and to kind of get an idea of what will happen if this is something that you choose to help manage your scoliosis.